even in death, let's learn something. Yeah, greetings, friends. Happy to meet you again, wherever you are watching from. My name is Davis Barihos Bagamuhunda, and I am happy to connect with you once again. It has been quite another long time, and I'm happy that we are quite well, and I hope everybody is well. And for those of you who may not be feeling well, I pray God's grace carries you through the tough times that you may be going through. Today's topic that I would want to share with you, as you can see here, is exactly we would want to share more and get to know what exactly caused Rusia's death. Many of you have been calling me, many of you are sending me messages, many are not sure what happened exactly. Others are still guessing, maybe this happened. And of course, I have not had time to respond to all the messages. As I mentioned, I have been grieving for these last 2 months. So I would want to make something very clear so that we really come to terms with the situation and we agree that we have to move forward. So what exactly caused Rusia's death? And this post is specifically for all of you, but majorly for people who are still not comfortable what exactly happened. You are still guessing, you are still wondering, you are still not in terms with this. Also for the many patients, many friends that Rusia had, many people that Rusia supported, who seemed to have lost hope. They were like, oh, we relied on this, we thought Rusia had healed. So I saw many messages come, and this is also for you to understand what happened. And also for all of those who are interested in making sure that the health sector and health services are very good for people and also have good health. This post is also for you. So what exactly caused Rusia's death? And as you can see here, this is a medical certificate for the cause of death. And this is by Realy Hospital. And I want to use this basically to confirm to you, but also for many of you to come to terms of what happened. So, as you can see, the immediate cause of death, cardiac arrest. The first thing I would want to clarify is that I have read several messages, many people saying heart attack, cardiac arrest, heart failure, or heart. All of those are guesses, but they are different things. I would want to state that there is a very big difference between a heart attack and a cardiac arrest. A heart attack is actually something that happens when blood fails to flow to your heart, either due to a blood clot or something in your veins that prevents blood from going to your heart. You get a heart attack. A cardiac arrest is something different, and this is only when your heart suddenly stops pumping. That's what we call a cardiac arrest. Suddenly your heart stops pumping, and then we call that a cardiac arrest. And the medical professions can explain more, but those two are different things. So for those of you who are saying heart attack, heart failure, those are different things, and this is why I actually made this post to make some clarification. But as you can see from the certificate, the immediate cause of death is the cardiac arrest, and the doctor has classified these into series. He say this was a consequence of hyperkalemia, and hyperkalemia is a condition where your potassium levels in the body rise beyond normal. So hyperkalemia, the doctor says, is what caused Rusia's cardiac arrest. And then he also says, as a consequence of hepatic failure. Hepatic failure is failure of the liver to perform its work. And lastly, he says, as a consequence of stage 4 breast cancer. Now, these are almost 4 causes, and this is what I want to clarify specifically to understand. And the good doctors around us will even help us understand more. But let me start from the last one, stage 4 breast cancer. Yes, we all know that Rusia was a stage 4 breast cancer patient. She had survived, she had moved along, she had thrived, she was faring very well. And although she had not been declared 100% cancer-free, she was doing extremely very well. Despite any challenges, she was really doing extremely very well. And there's nobody who does not have any pain. So, although she still had some issues with her body, but she was doing very, very well. And in the 4 years, she was really progressing steadily, even to reach a stage of remission if she had progressed maybe to the 5th year and so on with the condition. But that didn't come, and she was still a cancer patient, I would say. But she had really progressed very well, as many of you may know. So a severe hepatic failure is the condition the doctor says, failure of the liver perform its work. Yes, she still had some liver issues, and that's what exactly actually took me to the hospital, because her liver enzymes were a bit high. And I knew, because I had done tests, I had also talked to the doctors in India, so that was not for me a surprise. But it was not a level that her liver was going to fail. For me, I don't get right the way the doctor states it. It was not a level, because in 2022 I had seen worse circumstances that her liver was even in a worse condition, but it managed to heal and get back. So as I will explain and as we will understand, this was not really the major cause of her death. And the hyperkalemia is what is most important, actually, for me. And of course, this is why I fought the doctor, because there is no relationship between hepatic failure and hyperkalemia, because the liver is not anywhere responsible for regulating potassium in the body. The liver regulates other things. The organ that regulates potassium is the kidney. So I don't think there should be a relationship between hyperkalemia and hepatic failure. So this is where I put a question mark. Of course, sometimes doctors write these things for accountability and, confirming somebody. Sometimes it's not true. And for me, this is the reason even why I'm making this post. So hyperkalemia is that the actual sense is that Rusia's potassium levels suddenly shot higher. And initially, the day before our admission, the potassium levels were normal. And potassium, as you may know, it is something we call electrolytes in the body. These are minerals that regulate several functions of the body, but majorly sodium and potassium are minerals that regulate the heart rhythm and the nervous system. So those ones must be monitored very well, and I think there wasn't very good monitoring, because the doctor identified that sodium levels were low, and he prescribed a sodium infusion to Rusia, and this is where I believe the reaction came from. Of course, she reacted to that infusion, because immediately after that infusion, just a few seconds after, that's when the condition became worse. And yet she was talking to the caretakers, the relatives, and everybody around there, and she deteriorated just within a few minutes, because I suspect, of course, the infusion caused what we call an electrolyte imbalance. The balance between the sodium and potassium couldn't be there. So ideally, the cardiac arrest had to come. That was the major thing. Yes, the liver somehow was not okay, but it was not the cause. I would highly state that, and I want to clearly state to you, and also you get to know that some of these things we need to know when you go to the hospital. We need to know how some things work. But majorly, as you will understand even in my next episodes, is that we need to look more on the causes of potassium levels going higher. And also, specifically for cancer patients, there are many things you need to look at. And this is very, very, very important for my friends, the cancer patients and the survivors, and everybody who is interested in this series. A cardiac arrest can be caused by many things, but specifically for cancer patients, this is important for you to know. I will specifically drill on the cancer patients because this is our case. The cardiac arrest, one, can be caused by, in a cancer patient, can be caused by about 5 things. There could be more, but one could be due to the side effects of the prolonged treatment. These chemotherapy, radiotherapy, their side effects can bring a cardiac arrest in the long term. And this is the reason why most of the patients, the doctors will tell you, always monitor your cardiac profile. They tell you do ECG, you go and do these tests to monitor the rate of the heart. That is the reason why, because they know at some time there could be a reaction. And this number one did not apply to Rusia, simply because her cardiac profile was very, very good, always, since 2022 when we did this. And we have been monitoring this every month. Even when we went to India, we did this. Her cardiac profile was very, very, very good. So that we ruled it out. And the second one is specifically due to, a cardiac arrest could be due to metastasis to the heart or the surrounding tissues of the heart. If cancer goes close to the heart or to the surrounding heart tissues, it can also accelerate a cardiac arrest. But this is a rare occurrence because even doctors who can add more information will explain. A heart is one of the organs that would rarely be attacked by cancer. Among other organs in the body, a heart is one of the organs that would rarely be attacked by cancer, for reasons that medical professions can even explain more. But this is a rare occurrence, and it still did not apply to Russia that cancer had metastasized to her heart. Yes, it went to the liver, it went to the bones, it went to the arm, to the lymph nodes, but not the heart. So this was also not another cause that we can discuss. The third one is what we call an electrolyte imbalance. An electrolyte imbalance is something that can also lead to a cardiac arrest. And this is my major suspicion. And most of you, as you may know, and there are minerals in the body, which we call electrolytes, that help the body do its function. And of course, there are many, but the major ones is sodium, potassium, and chloride. Those are the major electrolytes in the body. They regulate how you take your water into the body, they regulate the heart rhythm, they regulate the imbalances, the nervous system. So this is exactly what happens. When there is an imbalance between your potassium and sodium, then the body may react. And I suspect this is what happened because Lucia was given a sodium infusion, hypertonic 3% sodium infusion, which was not monitored well. The doctor didn't monitor well to know how it could actually be effective, because after demonstration, he wasn't there. And this is really where the error came in. But I suspect and I believe this actually caused the electrolyte imbalance that led to the cardiac arrest, because sodium, potassium levels the day before were normal, sodium levels were high, were low actually. Sodium levels were low, potassium levels were normal. So he opted that we should raise the sodium levels but they didn't monitor how this would affect. So immediately after the sodium infusion ended, that's when Russia started reacting and became unstable. So I suspect this didn't, and the doctor was not there. The nurse was also not cooperative, as you'll see in my next episode. It really wasn't managed in time, and it ended up bringing the cardiac arrest that was also not managed in time. And I suspect and believe that this was the major cause of her death. But going forward, number 4 could be you could get a cardiac arrest also if you're a cancer patient because of sepsis or severe infections in your body. Sepsis is when you get infections in your blood and it is flowing. That can also cause a cardiac arrest. And the number 5 is if, for example, you had prior heart conditions and you are a cancer patient, your heart conditions can be exacerbated by cancer treatment, and then you also get a cardiac arrest. So, as you can see, these 5 factors that may lead to a cardiac arrest for cancer patients, much of them don't apply to Russia, apart from the electrolyte imbalance. And this is what I believe we are led to us losing Russia, although the hospital may explain some other things and so on, but this is also based on expert advice. There is a lot of research on this. We believe that it wasn't managed very well, and I was there in my presence. Good enough, I witnessed everything, and that's why I'm here to tell the full story, so that even in death, let's learn something. And for me, my fellow medical teams and other people who are in the medical profession, they need to know that even in death, we need to learn opportunities for improvement. And this is very critical for all of us, especially the cancer patients, that you need to know even what the doctors are doing on you. For me, the fact is that really the condition was not managed in a time, and this is what you learn more in our next episode of our care and support at our. Thank you very much, and I wish you a very good day.